Welcome, Thriving in 3. These are your tips to thrive in 3 minutes, right?
In a treatment.
In a treatment. Okay, so you ready to go? We're going to do the first one.
Not in love, because that takes a lot more than 3 minutes to describe here, especially with this one.
I think we can do better than 3 minutes. Okay, let's get to it. First one.
All right, how to thrive in 3 minutes if you're trying to improve lines and wrinkles of the chest.
The chest, and the chest is very important, right?
It is, and so this is an area, when we talk about the decolletage, this is a video of it. I like to mark it by delineating the supraclavicular notch is the superior border of the chest.
The supraclavicular notch.
And then the lateral borders are defined by the midclavicular line. And I usually drop to that fourth rib, kind of where I just pointed.
Yeah.
And then I draw kind of 2 diagonal lines down into the cleavage.
Okay, so what if wrinkles are outside that pattern?
For whatever reason, I find that it usually isn't.
Okay.
Yeah.
So you always stay within that pattern?
I usually stay within that pattern.
For safety reasons, or?
Because that is where the majority of lines and wrinkles are. So I want to make sure that I'm efficient with my product utilization. I don't want to deliver it or put it in areas where I'm not going to really get bang for my buck.
How common is this?
In San Diego, it's pretty common.
Okay, let's get to it.
All right, so here you saw me mark. I do like to try to draw a midline so that I kind of keep myself honest.
Get me to the procedure.
I'm talking about the procedure. All right, I do little numbing dots with 1% lidocaine with epinephrine, kind of measuring my cannula, which is going to always be a 22 gauge, 2-inch cannula, a more rigid cannula.
Okay.
And I figure how I'm going to, the space between those numbing dots is kind of how I determine where my numbing dots are going to be. And then I'm using, in this video, calcium hydroxylapatite, and I'm using it at a 2-to-1 dilution.
Okay, what depth are you at?
I am in the subcutaneous plane, guys. Your basically dermis and epidermis are no more than 1.3 millimeters here. And then you're at pectoralis fascia at about 3 millimeters. So you're dancing in a space of 1 millimeter.
Okay, and then are you doing, how are you laying down the strands?
So you can see right here that I'm kind of entering at a 30-degree, basically horizontal to the dermis.
Okay.
And I'm delivering 0.1 cc's of my diluted product with each 2-inch retrograde linear
How much
strand.
total are you putting in?
I'm delivering 1 syringe of calcium hydroxylapatite, but in total 4.5 cc's of diluted product.
What are you worried about?
I'm worried to be very gentle. You can see me wiggling here so that I don't penetrate into a reticular vein. There's a lot of veins, especially in women who have had chest augmentation.
Yeah.
And so you just want to make sure that obviously you're more likely to create a bruise than anything else. There are obviously arteries that run here, so just be gentle as you maneuver your way through.
And then how many treatments do you use? 1 treatment, 2 treatments, 3 treatments?
In a pilot trial, we did 3 treatments spaced, each treatment 6 weeks apart. At 9 months after the last treatment, we saw at least a 1-point change on a 5-point scale in chest wrinkles.
And would that 5-point scale happen to be the Fabby-Bolton scale?
It was in that study, it was the Fabby-Bolton scale.
The Fabby-Bolton scale, the famous Fabby-Bolton scale for chest.
Do you want to tell them who you thought Fabby was in that Fabby-Bolton scale?
That's for another video.
Okay. Because God forbid a woman could actually figure out a freaking scale.
Okay. How long does it last? How long do you tell patients it's going to last?
So we saw that at least 9 months after the last treatment, it continued to improve because these biostimulators are drawing on fibroblasts that really are even coming in at 7 months after the last injection.
Okay.
So I tell my patients, just come in to maintain once a year after the last treatment, but you're not going to have a drop off of your result for a while.
Okay, so not yet FDA approved with using calcium hydroxylapatite, but a very popular treatment in your practice.
Absolutely. There you go. Now you can thrive in 3.
Thanks for watching, and please hit that like button.
And make sure to click on subscribe so that you can stay most up to date on all things thriving.
Like me?
You need to subscribe.